All right, guys, welcome to the week 6 content review. Congratulations on those who took your lecture and lab exam already. Congratulations for getting it done and moving on to the next part of the course. Again, I want to remind you that these videos are not a replacement for your time spent in lecture, lab, and office hours. This is just a supplement to those areas to make sure you can make this content that you're seeing more foundational. But in saying that, we're going to be moving on to the musculoskeletal system, looking at the anterior, posterior, medial thigh, as well as the knee and some bones, associated bones and ligaments. But with that, let's get started with the femur. So get out your content sheets, and we're going to start moving through these structures and getting a 3D perspective of them. One thing I want to say is make sure that you guys are starting to do those content, or sorry, what is it, the muscle guides, the tables, the compartment tables. Make sure you guys are doing that so you can understand the muscles in each compartment and understand their related function. Because if you understand what a compartment does, it makes it easier to single out the muscles in that compartment that do the opposite of what they're supposed to do. Um, so make sure that you do that just to understand what the muscles are doing and see it from a different perspective. If you try to memorize every single muscle individually, it's going to be a lot harder than compartmentalizing all of the muscles in each compartment. So, but let's get started with the femur. So the femur here, I'm going to press on the femur, right? This is our femur. Um, Let me inspect it. All right, so we have a couple different structures on the femur, right? So this is the largest bone in the body. It handles a lot of the weight and pressure from your upper organs and your upper limbs. So this is one of the strongest bones, the strongest bone in the body. Um, so the head of our femur is here, right? This is the neck of the femur connecting the shaft and the head of the femur, right? So neck of the femur. And then on the posterior of the femur, we have the greater trochanter and lesser trochanter. So trochanter is a larger tuberosity. So greater trochanter, lesser trochanter. And then we have our condyles of the femur, right, which are more distal, right? So all these structures we just talked about were proximal. Now we're going to be looking distal, right? We have our medial and our lateral condyle, right? Medial and lateral condyles of the femur. So medial condyle, lateral condyle, together they are condyles, right? And more anterior, we see the patellar groove, right? This is where our patella is going to sit, but there's going to be cartilage in between the patellar groove and the patella. All right, and I can remove myself from inspector so we can see where the patella is, right? So, right, there's cartilage in between the patellar groove and the actual patella. But okay, let me remove those structures. Let me hide that. Okay. All right. So we just saw our patella, right? This is our patella. Small bone, right? Kneecap. All right, I'm going to remove that. And I want to show our tibia, right? So this is our tibia. And I'm going to inspect that. So on our tibia, we have our tibial plateau, right? The most superior aspect of the tibia is the tibial plateau, right? And then we have our tibial tuberosity. This is where our patellar tendon is going to attach to if I go back to pelvis and thigh, right? I press the tibia and then I press the patellar ligaments here. Examine. Right, so the tibial tuberosity, right? Tibial tuberosity is right under where the patellar ligament is attaching to. Okay, and that's all the structures for the bones. Now we're gonna move on to the knee model. All right, so here we see our knee. Um, so we're gonna go over a couple different structures in our knee. So the first things that I want to talk about are the medial and the lateral menisci. Right, so medial meniscus and lateral meniscus. Right. These other two structures here we don't need to know about. Let me just remove those. So the coronary ligament, we don't need to know that, so I'm going to hide that. So just the, and we don't need to know the transverse ligament as well. So just these two right here. So the medial and the lateral meniscus, right? Together they're known as menisci. So the medial and lateral menisci. Menisci is plural. Meniscus is singular. So medial meniscus, lateral meniscus. All right, so we see those there. I want to remove the femur just so we can see them a little bit better. So we remove this. All right, the femur and the cartilage. Okay, all right, so all right, we're looking at the tibia, right? This is our shin bone, right on top of the tibial plateau. We see the medial and the lateral meniscus. Medial meniscus, lateral meniscus. All right, so okay. So now we're going to look at the I want to look at the medial and the lateral collateral ligaments. So, right, so imagine we're looking at our thigh, right? So our thigh and our leg. Right, this is medial and this is lateral, right? Our fibula, we're gonna get to know this next week. This is always gonna be on the lateral side, right? Our shin bone, right, is always gonna be more medial, right? So this is medial, this is lateral, right? So this would be our medial collateral ligament, and this would be our lateral collateral ligament. Right, so medial collateral ligament, lateral collateral ligament, medial collateral ligament, lateral collateral ligament. All right, and then we're going to look at our cruciate ligaments, right? So I'm going to click on the first cruciate ligament, right? This is our anterior cruciate ligament. It's going from the anterior tibia to the posterior femur, right? Right. It's going from the anterior tibia to the posterior lateral condyle, right? So of the femur, right? So posterior lateral condyle of the femur, anterior tibia. And if I examine, right, you see how it's going from anterior tibia to posterior lateral condyle of the femur. All right, and now I'm going to press on the PCL, right? So that was the ACL. Now we're looking at the PCL, so anterior cruciate ligament. Now we're looking at the posterior cruciate ligament. The posterior cruciate ligament is going from posterior tibia to the medial condyle of the femur. If I examine, all right. Now let me do the same thing for the medial and the lateral collateral ligaments, just so we can see. This is posterior, this is anterior. All right, so now that we have those down, we're gonna move into the anterior thigh muscles. All right, now here we can see the thigh. So let me center it a little bit more just so we can see it better. Ooh. Okay. So now we have our thigh. So the first muscle that we're going to start off with is rectus femoris. Right, rectus femoris, right here, the first quadriceps muscle. There's four of them in our anterior thigh. Rectus femoris is going from the ilium. Right, we can see the ilium right here. Right, the ilium is going all the way to the tibial tuberosity. Right. All the way from the ilium to the tibial tuberosity. And rectus femoris is responsible for hip flexion and knee extension. Hip flexion and knee extension. So all the muscles in the anterior compartment are going to flex the hip and extend the knee. And sartorius is our only exception for that, but generally they're going to flex the hip and extend the knee. Next, so if I remove rectus femoris, right, and we have right beneath it, deep to rectus femoris, is vastus intermedius. Vastus intermedius. It goes from the femur to the tibial tuberosity. Vastus lateralis, vastus medialis, so vastus lateralis, intermedius, and medialis. They all go from the femur to the tibial tuberosity, and they all deal with knee extension. They all go from the femur to the tibial tuberosity, and they all deal with knee extension. So vastus lateralis, vastus intermedius, and vastus medialis. Right, they all go from the femur to the tibial tuberosity, and they all deal with knee extension. All right, so if I remove those muscles, right, those are all of our quadriceps muscles. So hide those. Now, the next muscle that we have is sartorius. So sartorius is our one exception in our anterior compartment. And sartorius is going to flex the knee and the hip, right? So instead of what the other muscles do in the anterior compartment, which is knee flexion and which is hip flexion and knee extension, sartorius is going to flex the knee and it's going to flex the hip as well. So instead of only flexing the hip and extending the knee, right, which all the muscles that we just talked about, that's what their function was, right? But sartorius is only going to flex the hip and it's going to flex the knee. So sartorius, right, knee flexion, hip flexion. The other muscles were only either extending the knee or flexing the hip, right? But this is going to do flexion in both the knee and the hip, sartorius. All right. And then our last muscle here is going to be iliopsoas. But one thing about sartorius, it's going from the ilium all the way to the medial tibia, right? So our ilium all the way to our medial tibia, right? Tibia. So ilium all the way to our medial tibia. All right, so if we remove sartorius, we're going to look at iliopsoas, right? So iliopsoas, right, it's formed by the conjoining of iliacus and psoas major. And iliopsoas is going to go from ilium all the way to lesser trochanter. So ilium all the way to the lesser trochanter. If I press on the bone here just so we can. Alright, so ilium all the way to the lesser trochanter. Ilium to lesser trochanter. right? And this is going to deal with hip flexion. And then this muscle here, tensor fascia latae, right? This muscle here, right? This muscle here, the tensor fascia latae, it's going to tense the fascia latae here, the IT band. All right, and we're going to move on to some neurovasculature, right? So looking at our femoral triangle, we can see a couple of different structures. So we have our femoral vein, we have our femoral artery, and then we have our femoral nerve. Right? Femoral vein, femoral artery, femoral nerve. Right? If we want to see the deep artery of the thigh, right? So that'll be this structure here. So I click on the press examine, right? We see our femoral artery, and then coming off our femoral artery in the femoral triangle, we see the deep artery of the thigh, otherwise known as arteria profunda femoris, right? Profundus, right, just means deep. Arteria is artery, and then femoris is obviously the femoral region. And then we're going to look at another structure, which is our great saphenous vein, right? So, right, if we, let me just remove that. So if we see our femoral vein here, right, our great saphenous vein is here, right, going all the way to the leg. So examine, we saw our femoral vein, femoral vein, and coming off our femoral vein is our great saphenous vein. All right, now we're going to move into the medial thigh. All right, so now that we can see the medial thigh, I want you guys to remember that sartorius, right? This muscle that's going from the ilium all the way to the medial tibia, this muscle is going to be our division from the anterior to the medial compartment, right? That's how we know we're in the medial compartment. All right, so the first muscle that we're going to look at in the medial compartment is gracilis. That's the first muscle that's on our content sheet. All right, this is going to be gracilis. Gracilis is going all the way from our pubis. So I press on the hip bone, our pubis, all the way to our tibia. Right, it's going from our pubis all the way to our tibia. This muscle is dealing with hip adduction and knee flexion. Next muscle we're going to look at is pectineus. So we said this is gracilis. Pectineus is all the way over here. So pectineus is going from our pubis to our femur. Right, pubis to our femur. And pectineus is going to hip adduct, right? So it's going to adduct the hip. So pubis to femur, adduction. So the muscles of the medial compartment are going to be innervated by the obturator nerve. The muscles of the anterior compartment, the ones that we just talked about with the quadriceps, those are going to be innervated by the femoral nerve. So femoral nerve, anterior compartment, medial compartment, obturator nerve. We're going to go look at the obturator nerve briefly. after we look at the adductors. So we just went over pectineus. Now we're going to go over adductor longus. Right. This is the adductor longus. Adductor longus goes from pubis to femur. So pubis, you can see it connecting here, all the way to the femur. Right. Pubis to the femur, and it's going to deal with hip adduction as it's in his name, adductor longus. Right. So adductor longus, pubis to femur, and it's going to adduct the hip. So all the muscles, so adductor longus, magnus, and brevis are all going to deal with hip adduction. So if I examine here, so I can see adductor, this is adductor longus. Let me myself examine. Okay, that's adductor brevis. So you see it going from pubis to femur. This is the adductor magnus, right? Pubis to femur. Okay. So, and adductor longus, just examine that one, right? Pubis to femur. And all these are going to be innervated by our obturator nerve. We can see the obturator nerve. Just want to show it coming through the obturator foramen. Right, so obturator internus is right here. So if I remove adductor longus, right, in between adductor longus and adductor brevis, we're going to see our obturator nerve, right? So this is our obturator nerve. So we see it coming out of the obturator foramen. We see it coming right on top of adductor brevis. So the muscles of the medial compartment are going to be innervated by the obturator nerve. Now we're going to move on to the posterior compartment, and then we're going to look at the gluteal region after. Alright, now that we're looking at the posterior compartment, or the posterior thigh, right? So we're looking at the anterior thigh here. We just went over the medial thigh. Now we're looking at the posterior thigh. So the posterior compartment, posterior thigh. The way that we know we're moving into the posterior thigh is after, so lateral to adductor magnus, that's how we know that we're looking at the posterior thigh, right? So adductor magnus was medial compartment, right? So after we move lateral to adductor magnus, we're in the posterior compartment. Similarly to sartorius, right? Right after we move lateral to sartorius, or medial to sartorius, right? So medial to sartorius, right? That means that we're in the medial compartment. All right, so sartorius, once we move medial to sartorius, we're in the medial compartment. All right, once we're at adductor magnus and we're moving more lateral, right, we're in the posterior compartment. So the first muscle that we're going to look at in the posterior compartment is semitendinosus. And actually, let me start with semimembranosus because it's the first muscle that we can look and see in the posterior compartment. So semimembranosus, remember semimembranosus is medial, right? So if I'm looking at the posterior thigh, right, the most medial muscle is semimembranosus. So membranosus is medial. So always try to get your bearings, right? When you're looking at the sacrum, right, that's how you know you're medial. If you're not looking at the sacrum, you're more lateral, right? Right. So if you're looking where the sacrum is, you're medial. If you're looking opposite of the sacrum, you're lateral. So let's start with semimembranosus. So semimembranosus is right here. If I examine semimembranosus, we can see it here. Semimembranosus is going from the ischial tuberosity all the way to the medial tibia, right? So I'm going to press on the femur and semimembranosus, as well as the tibia. All right, so semimembranosus is going from the ischial tuberosity all the way to the medial tibia, right? So this is our lateral tibia. This is our medial tibia, right? Medial is right near the sacrum. Lateral is opposite of that. And this muscle is going to deal with hip extension and knee flexion. All right, so if I press on semitendinosus, right, we can see that here. Semitendinosus. Semitendinosus is going to go again from the ischial tuberosity all the way to the medial tibia, right, following semimembranosus. This muscle is again going to deal in hip extension and knee flexion. And then we have biceps femoris, which is the last muscle that we're going to be looking at in the posterior compartment. All right. So you have biceps femoris. It has two heads. Let me just click on the other one. So that's the short head. All right, so short head, long head, and then it has the conjoined muscle up here. Okay, there we go. All right, so we see biceps femoris here. All right, biceps femoris. We have our long head here. This is our short head. I thought I just clicked on it, but I guess not. Okay, there we go. So biceps femoris. We have our short head and our long head, right? Bi means two. All right, so biceps femoris. Right, these two muscles here. 1, 2. Right, biceps femoris. I'm trying to get this like one sliver of the tendon, but it's not that serious. So we have biceps femoris. So long head, short head. And again, these muscles are going from the ischial tuberosity to the fibula, right? So the long head's going from the ischial tuberosity to the femur. Let me show you guys that. All right, so the long head is going from the ischial tuberosity all the way to the fibula, right? So fibula all the way to the ischial tuberosity. And then the short head's going from the femur to the fibula. So I press on the short head. It's going from the femur all the way to the fibula. So if I press on my fibula here, you can see how the long head is going from the ischial tuberosity all the way to the fibula. This is the long head. Short head's going from the femur all the way to the fibula. Right, and this muscle is dealing with hip extension and knee flexion. Long head does hip extension and knee flexion. The short head only does knee flexion. Right, and now we can look at some vasculature structures in the posterior compartment. Right, so the femoral artery and vein, right, so femoral artery and vein are turning into the popliteal artery and vein. So once we go through the adductor hiatus, the femoral artery and vein turn into the popliteal artery and vein. And let me show you guys what the adductor hiatus looks like. So adductor magnus has this big hiatus. Adductor magnus has this big hiatus. So once you, let me remove these muscles here. Right, so this is adductor magnus. Right, you can see gracilis, so you can see adductor longus. Right, we see sartorius. This is adductor magnus, right? So this is called the adductor's hiatus, right? This little triangle right here, adductor's hiatus, right? And once the femoral artery and vein go through the adductor hiatus, they become the popliteal artery and vein. So let me press on that here. Femoral artery, femoral vein. All right, we see it. Once the femoral artery and the femoral vein go through the adductor's hiatus, right? So it's still the femoral vein, but once it leaves the adductor hiatus, it becomes the popliteal artery and the popliteal vein. Popliteal artery, popliteal vein. All right, so let me remove that, right? Popliteal artery, popliteal vein. Artery and vein, right? Once we go through the adductor hiatus. All right, let me get back the full thing here. Okay, and then we also see in the posterior we have the sciatic nerve, right? This big nerve here, major convergence of the lumbosacral plexus, the sciatic nerve. Right, and that's going to split. We're going to learn about the branches of the sciatic nerve next week, so don't worry about that. So again, we went over the popliteal artery, popliteal vein, and then we went over the sciatic nerve as well. So the last region we're going to go over is the gluteal region. And again, I want to mention that the posterior compartment, the major muscle actions of the posterior compartment is hip extension and knee flexion. So hip extension and knee flexion. All right, so posterior compartment, hip extension, knee flexion. The medial compartment is going to adduct the hip and flex the knee, and the anterior compartment is going to flex the hip and extend the knee. All right, and look for those exceptions, the muscles that are doing only one of those functions or doing opposite functions in those compartments, but really remember to compartmentalize these muscles. So the last compartment that we're going to look at is the gluteal region. All right, the biggest muscle in the gluteal compartment is the gluteus maximus, right? Gluteus maximus. Okay. So our gluteus maximus is going all the way from our ilium, sacrum, ilium and sacrum to our femur. Ilium and sacrum to our femur. All right, and this muscle is going to deal in hip extension. So gluteus maximus, right? It's going from our sacrum, ilium to our femur, and it's dealing in hip extension. Right, so this is going to be innervated by our inferior gluteal nerve. Okay. Right, so we see, we zoom in a little bit more, right? This is going to be, yeah, okay. Right, we just saw that, right? So this is going to be our inferior gluteal bundle. Right, so all this is going to be our inferior gluteal bundle. This is going to be our superior gluteal bundle. And if we look for piriformis, right, this is our piriformis muscle. If we look for piriformis, our this is going to be our bearing, right? This is going to be our identifier for where we find the superior and the inferior gluteal bundle. All right, does that make sense? Okay. And then now that we have gluteus maximus, we're going to go to gluteus medius. So gluteus medius goes from the ilium to the greater trochanter. So we can see it going from the ilium, right? This is our femur, and the greater trochanter is right here. Right, we can see it going from the ilium to the greater trochanter. All right, and that's going to deal with hip abduction, so going away from the midline of the body. All right, and that's going to be innervated by the superior gluteal nerve. And let me find the inferior. Okay, there it is. Okay, this is our inferior gluteal nerve. All right, so our inferior gluteal nerve is innervating gluteus maximus. Our superior gluteal nerve is innervating gluteus medius and minimus. So that's our inferior gluteal nerve. Okay. So now if I remove gluteus medius, I can see gluteus minimus. Right, gluteus minimus is going from our ilium to our greater trochanter as well. It's going from our ilium to our greater trochanter, and it's dealing again in hip abduction. All right, so innervated by the superior gluteal nerve. All right, so now we're going to be looking at the piriformis. As we spoke about, piriformis is our bearing for when we want to know what's superior and what's the inferior gluteal bundle. So I press piriformis. So piriformis is going from the sacrum to the greater trochanter. So I examine, so sacrum to the greater trochanter, piriformis, and it's dealing with external or lateral hip rotation. Now if I press obturator internus, It's going from the obturator foramen all the way to the greater trochanter. So we can see it going all the way around the obturator foramen, all the way to the greater trochanter, and again dealing with external or lateral hip rotation. We have quadratus femoris. Right, it's going from the ischium all the way to the femur, dealing with external or lateral hip rotation. And then we have superior gemellus. Right, it's going from the ischial spine all the way to the greater trochanter, and it's dealing with external or lateral hip rotation. And then we have the last one, inferior gemellus. So that was superior. Now we have inferior gemellus. Right, it's going from around the ischial tuberosity all the way to the greater trochanter. Right, and it's again dealing with lateral or external hip rotation. Inferior gemellus, superior gemellus, obturator internus. So superior gemellus, inferior gemellus, right? And then we have our obturator internus. All right. And one thing I want to show us is our sacrotuberous ligament, right? Sacrotuberous ligament is going from our sacrum all the way to our ischial tuberosity. Sacrum all the way to the ischial tuberosity, so it's sacrotuberous ligament. And that's all the structures for this week. I hope this helped, guys. I know it was a little bit on the longer side. I tried to slow it down a little bit. But let me know if I can change anything to make these videos more helpful. And good luck on this week's quiz.